This product, Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations, has different uses depending on the brand. Some brands are used to treat minor aches and pains of the muscles and joints, like arthritis, backache, and sprains. Other brands are used to help relieve itching and skin irritation caused by sunburn, insect bites, or minor scrapes. The active ingredient, menthol, acts as a counterirritant, causing the skin to feel cool and then warm. The recommended dosage and optimal timing for using this product may vary, so it's important to follow the instructions on the label or consult with a healthcare professional. When using this medication, be sure to follow the instructions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This medication is for use on the skin only. Apply to the affected area no more than 3 to 4 times a day. If you are using the cream, gel, or liquid, rub in gently and thoroughly. Some liquid forms of this medication should be shaken before use. Check the manufacturer's information for specific directions. Let the medicine dry completely before letting anyone else touch the area. After applying, wash your hands well unless you are using the medication to treat the hands. Avoid getting this medication in your eyes, nose, or mouth. If you do, flush with plenty of water. Do not apply to serious burns or deep wounds. Do not bandage or tightly wrap the affected area. You may cover the area loosely to protect clothing. Heat can increase the risk of side effects. Do not apply this medication right before, during, or after activities that increase skin temperature, such as bathing, swimming, heavy exercise. Wait until your skin has cooled before applying the medication. Do not use a sunlamp/tanning bed, hot water bottle, or heating pad/device on the treated area. Check the ingredients on the label even if you have used the product before. The manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients. Read the label carefully to make sure you have the right product for you. Ask your pharmacist if you have any questions. If your condition lasts for more than 7 days, or if it gets worse, or if it keeps returning, tell your doctor. If you think you may have a serious medical problem, get medical help right away. Side effects of Blue Gel 2% may include redness, warmth, or irritation at the application site. If these effects persist or worsen, notify your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the risk of side effects. Many people using this medication do not experience serious side effects. Discontinue use and contact your doctor immediately if you experience serious side effects such as blistering or swelling at the application site, or increased or unusual pain at the application site. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. In the U.S., call your doctor or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor or report side effects to Health Canada at 1-866-234-2345. Before using Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations, it's important to inform your doctor or pharmacist of any allergies you may have, especially to menthol. This product may contain inactive ingredients that could cause allergic reactions or other issues, so be sure to discuss this with your pharmacist for more details. Additionally, it's crucial to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, it's important to disclose all the products you are using, including prescription drugs, non-prescription drugs, and herbal products to your doctor or dentist. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is also uncertain whether this medication passes into breast milk, so it's best to consult with your doctor before breastfeeding. When using Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations, it's important to be aware of potential drug interactions, as they can affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure that you are using Blue Gel 2% safely and effectively. If this medication is ingested, it can be dangerous. If a person has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, they should call 911 or go to the emergency room immediately. Residents of the United States can contact their local poison control center at 1-800-222-1222. Residents of Canada can reach out to a provincial poison control center for assistance. It's important to keep all your regular medical and lab appointments when using Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations. This will help ensure that you are getting the maximum benefit from this medication and that any potential side effects are being monitored. Be sure to follow your doctor's instructions for using this medication, and don't hesitate to ask any questions or voice any concerns you may have during your appointments. If you forget to use this product at the scheduled time, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Don't take double the dose to make up for the missed one. Remember to use it regularly for the best results. When it comes to storing Blue Gel 2% Topical Dermatological Irritants-Counter-Irritant Formulations, it's important to keep it at room temperature. Different brands may have different storage requirements, so be sure to check the product package or ask your pharmacist for specific instructions. Keep all medications away from children and pets, and do not flush them down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.